Anybody wants to do? Dr. Irfan?
Yes, I don't know about haloperidol and I can do this scenario, but in the view of other drugs, which I know very well.
This haloperidol was, I think it came on somewhere in the exam.
Jeddah it came actually.
Somewhere it came, yes.
It is similar to other drugs only. Just you have
Yeah.
to just go the side effects and then you can do no problem.
Okay, no problem. I will try to do. No issue.
Okay. So take 3 minutes for preparation so we can. But if you wish, I will do no problem. Here this onco ward, she is receiving alopurinol, but previous night she received haloperidol instead of alopurinol. So talk to Jenny's father, Ahmad. Okay.
Dr. Irfan, can you try this or still voice not working? If not, then I will be the role player. Hello?
No problem.
Okay, fine. No problem. No problem. Okay, you be the candidate. I will set the time. Okay.
Hello, I'm Dr. Sandeep.
Hello.
Good evening.
Good evening.
Am I talking to father of Jenny, Mr. Ahmad?
Yes.
Okay, Mr. Ahmad. So how are you doing today?
Yes, I am fine, doctor.
Yes, Mr. Ahmad, today I am here to discuss with you one issue that has occurred previous night with Jenny's treatment. Is this right time to talk to you?
Yes, doctor.
Okay, so shall I start or do you want someone to join our discussion?
No, I am alone. But what issue, doctor?
Yes, Mr. Ahmad, I will come to that. So before that, can you please tell me what have been your updates regarding Jenny?
Jenny is receiving some treatment for her condition, and she's here in the ward because of this alopurinol and some chemotherapy.
Yes, Mr. Ahmad, I appreciate your updates. Today, actually, I am on behalf of our team. I'm here to apologize because Jenny last night received, instead of alopurinol, another drug called haloperidol. I'm really sorry to tell you about this, Mr. Ahmad.
What, doctor? What you are saying? How can you give a different? It's a totally different drug, right?
Yes, Mr. Ahmad, you're absolutely right, and we are really sorry that this incident has happened. However, Jenny is stable right now, and we are taking necessary measures, Mr. Ahmad.
So, doctor, what will happen to Jenny now? She's already suffering from cancer.
Yes, Mr. Ahmad, your worries are quite understandable. This haloperidol drug usually used in patients with some mood disorders, like it is a psychiatry medicine. But one dose of such medicine usually does not cause any side effect. However, we will monitor Jenny for sometimes this drug can cause dryness of mouth, sometimes it can cause fever, urine retention. Sometimes it can cause some abnormal movement, but we are observing Jenny for such side effects, Mr. Ahmed.
But who did this mistake? I want to know the name.
Mr. Ahmed, I am really sorry to tell you that actually we have still investigating the problem. and we are not currently in a position to tell you exactly who did this, because this is not a error of one person. Actually, from prescribing the medicine and to the receiving the medicine, it's a chain of events. So this chain of events, there is some error somewhere has occurred, but we are investigating and we will definitely get into the bottom of this issue, Mr. Ahmed.
But
Is this okay, Mr. Ahmed?
doctor, this is a careless hospital. You know, I don't want to continue treatment here. Uh, can you give discharge? I want to take her to other hospital. What such a carelessness is there? I want to complain also.
Mr. Ahmed, I can see that you are offended with the issue which has occurred. But I would like to assure you that we have already informed the consultant, and we are observing the Jenny right now who is stable. And we have informed our practice manager also, Mr. Ahmed. So we are taking the corrective measures.
But will that solve my problem? Will that help my child, doctor? Is what other side effects will she have because of this medicine? I heard this is kind of a psychiatric medicine. Will she have any fits or any crazy behavior because of this?
Mr. Ahmad, I appreciate your knowledge. It can occur with this medication, but it is a very rare phenomenon. And one dose of this medicine is very unlikely to give rise to fits and other serious side effects. Also, she is under our observation, and we will definitely intervene if anything such comes up, and we will involve the brain doctor or the drug doctor if necessary, Mr. Ahmad. We are trying to do our best in the Janice care, Mr. Ahmad.
Brain doctor? Why you will involve brain doctor? Doctor? What's wrong happened to the brain?
As we just discussed, it can cause fits in rare cases. If that problem comes up, then we will involve. Otherwise, she does not need involvement of the brain doctor right now. And Mr. Ahmad, we will definitely try our best to prevent this error to happen again. And I assure you that we will double check the dose and we will do some fluorescent markers so that this is not repeated again, Mr. Ahmad. Are you okay with this, Mr. Ahmad?
Yes, doctor. But what is the long-term impact for this issue? 6 minutes. What will happen? What I need to observe when I take her home?
Mr. Ahmad, this is a very good question. But I would like to tell you here that there will be no long-term problem with this drug, because after a few hours, this drug will get thrown out of the body, and Jenny will not have any problem uh, with this because of one dose. And we will take care that she will receive her other medications on time, and no further errors will occur with her medication, Mr. Ahmed. Yeah, I will assure that this will not get repeated again, Mr. Ahmed.
Is there any medicine which can clear the side effect of this?
So right now she is not suffering from any side effects, and already she is stable. We will observe her. So she does not require any treatment as such for this, Mr. Ahmed.
Okay. So I want to complain about this. How can I complain, doctor?
Mr. Ahmed, we have informed consultant and we have informed practice managers. However, if you still like to complain, I can guide you through the patient advisory and liaison services, through which various steps can be followed, and you can raise your issue, Mr. Ahmed. Okay, Mr. Ahmed?
Okay, okay, doctor.
So, if you don't mind, can I go through the various points which you have just discussed?
Yes, yes, doctor.
Actually, today we had discussion regarding that Jenny has received haloperidol instead of alopurinol. I have told you what could be the implications of this drug and what are our plans for monitoring Jenny. we have also discussed what measures we will take to prevent drug error to happen again. So you said you would like to complain, and I have assured you that I will guide you through the various steps of SPALS, and we will definitely do our best to prevent the drug error again. Okay, Mr. Ahmed.
Okay, okay, doctor.
And I would again like to apologize on behalf of my team that this has happened, and we will observe the journey, and we'll assure you that the drug error will not happen again. Thank you, Mr. Ahmed, for your time.
Okay, thank you, doctor. Thank you. Still time is there. 50 seconds is there.
50.
Hmm.
क्या बोलने का अभी? Okay, most of the points are covered.
Yeah, fine. All right. So your information was correct, but apology, you came very late. In the last, you came.
No, I said in the beginning only. I would like to apologize on behalf of my team that one error has occurred.
Any medical error, 2 to 3. They say at least 2.
I said 3 to 4 times. 3 to 4
Okay.
times. I'm sorry. I would like to apologize. 3 to 4 times I said.
Okay, maybe I missed that. So
You are under influence of previous scenario.
no, I will see in the recording. No issue. Okay. So that was one thing, and the side effect you mentioned about dry mouth, abdominal pain.
Urinary retention.
Yeah.
Normal movements.
Yeah. So I mean, each the most dangerous effect you have to little bit elaborate more. Like you have to say generally it does not cause, but these are the side effect which has some concern, and for that we will do XYZ steps. Like abnormal movement is something which threatens or kind of afraid. It gives like a fear to the any patient, right? Like something like what you call that perinom metoclopramide. It creates a panic whenever there is a dystonia because of that. Am I right? So
right,
that
right.
to little bit emphasize whatever the prominent side effect. If it is less like nausea, vomiting, something, you don't need to even go into much detail about.
But I mentioned fever, dry mouth, urinary retention, abnormal movements.
So urinary retention, you need to, let's say, can be the distension, can be like stoppage of urine for a couple of hours. But for that, we'll monitor, we'll see. Like you need to reassure me, which makes me a panic. Any side effect which gives me a hint, like it can be something what happened wrong. That to give a little extra bit of it. That is one thing. Practice manager and all you involved nicely. That was very good. And at the end, you can mention like I will give you leaflet about the side effect of haloperidol and trusted website. That also. Hello, medicine you can give medicine leaflet.
Okay. Okay.
And point of time, brain doctor, mind doctor. It's a mind doctor, psychologist or psychiatrist, not even psychologist. Not a brain doctor, mind doctor.
For feeds, what we will do? We'll involve neurologist only, no? For feeds.
Then you have say nerve doctor.
jargon का बहुत लफड़ा है यार ठीक है
because this is what we are hearing now. Nerve doctor. I have no idea why we cannot say brain doctor. I mean, must be brain doctor means neurosurgeon. Now doctor means neurologist, and mind doctor means psychiatrist. Probably that could be the reason why these are the like terminology.
Sometimes I wonder what can we say to proctologist.
Yeah, tumor doctor.
Proctologist, oncologist, ne, proctologist.
Oh, proctologist. Question mark.
Okay. Chalo, anything else?
Okay, so otherwise it was good. So let's move on
I
to.
think my speed of talking is still more.
No, this was, the time was there.
Okay.
This you,
And this,
this you like wind it, each and everything you cut shorted. You said in one line, dryness of mouth, some movement, abnormal movement. You didn't go in much detail, so you cut short it too much. I was expecting like because it's you are making a like it's kind of error happen, and if it is a simple error, then the scenario it will not have that fighting kind of the things or the parental conflicts and all will be less, the less side effect.
What may be the answer for if she want to discharge her baby?
this is the negotiation we have to do. We have to tell patient is stable. We are discussing with the consultant. We are involved this one. We are monitoring this. We are monitoring that. So stay here. And we know her treatment from the beginning. That I forgot.
Yeah, that
Patient family,
you did not,
staff. I forgot.
as Rohel has pointed out, that no, I asked you question. I don't want to continue treatment here. I want to take my child to other hospital. Then usual answer about this, like as you said now, like we are familiar, we are treating it is not good for your child to leave the halfway treatment, and if we are providing it the same norms, and the same kind of norms will be followed in other hospital also. So we'll continue. It is better for the safety of child till he becomes stable, till we have the all lab results. Once we are sure that he is fine, then it is better to take to the other hospital.
We
Right?
can say that it to discharge and to go to other hospital, it will take time.
We can say once she becomes stable, we can discuss with the consultant.
Yes.
Not like
What
it
is
doesn't
the
go.
management for this overdose of haloperidol?
No, just observation.
Only,
If
or we are
complication.
doing for any drug level?
No, no, not mentioned actually.
Drug level.
Have leaflet? You have leaflet about it?
No, actually, I couldn't find it. The leaflet. Just I read the information about haloperidol and rest of the scenario as.
Right, it's not.
From where? From where you get this?
Google information is Google, but other things
Google.
we do with other drug error also, no? Like other drug error, missing the drug or like methotrexate or something we do regularly, regular medicines.
Okay,
Like
so
gentamicin overdose, we do the same thing, negotiation. Here, the negotiation is main part. But this gentamicin has this drug level. Other drugs, I don't think we have to do.
okay.
Next meeting we will do a cyclovir. This drug error. We'll finish up this all drugs.
So one is remaining. Let's finish that, the last scenario.
Then I will finish that now.
We can wind up the things.
Just a minute, I'll check what is the scenario. Dr. Hiren, you want to do or you are busy on the duty?
Oh, Dr. Rohit? Yeah, ask if he wants
injection?
to. Yes.
Pharmacy.
Why not?
Sorry, I'm busy actually.
25-weeker baby was delivered on ventilator, had grade 4 hemorrhage and various complications. So there was a discussion regarding the withdrawal of the care of the baby after discussion with the parents. Okay. And because of this, one medical student is upset. You can say what? Take Ahmad. Okay.
Okay, so baby is 25 weeks, right?
25 week and had grade 4 hemorrhage, maybe brain death also. And DNR was decided, like withdrawal of the care after discussion with the parents. But the medical student is not happy with this decision.
Okay.
Discuss the medical ethics with the medical student.
Right. Fine.
2 minutes if you want.
Okay, so I will take few seconds. So just I would like to reconfirm the background information. 25-week grade 4 IVH and is on multiple medicine support, inotropes and all, right?
Yes.
And consultant has decided to withdraw the support and DNR, and talk has been done already with the parents.
Yes, yes. The parents agreed.
Parent agreed. Okay, fine. Okay. All right, so I'm ready. Let's start. Hello, good morning.
Just a minute. I'll set the time. Start.
Hello, good morning.
Good morning, doctor.
I am Dr. Hiren. I guess I'm talking with Dr. Ahmad. I think we met before in the round. So, Dr. Ahmad, how is your posting going on in pediatrics?
Yes, yes, doctor. I know you because you are one of the most hardworking doctor here and knowledgeable also. My posting is going good, doctor. I'm learning few things, but today I'm upset regarding one patient, doctor.
Sorry. Okay.
Hello.
Okay. Sorry. So yes, Dr. Ahmad. I got a cough. Sorry.
Take your time. We'll pause for 2 seconds. No problem.
Yeah, just a minute. Okay. So, Dr. Ahmad, I really appreciate your interest. You are a very good student. So, tell me what you want to learn today from this meeting.
Yes, doctor. There was one patient in the NICU. For that patient, the consultant convinced the parent regarding not continuing the treatment and decided to not resuscitate the baby. Do you think that this is correct, doctor? Because that we are just killing the child by doing so.
Yes, Dr. Ahmad, I can understand your you are willing to know about this, but Dr. Ahmad, this is called medical ethics, are based on the guideline which is provided under the framework of medical ethics. This type of decisions are being taken. So, have you any idea about medical ethic and framework of ethic?
No, doctor, I don't have any idea, but I think something related to justice, like that I have heard, but not much idea.
Yes, yes, Dr. Ahmad, you are right. I appreciate your knowledge. So here it is not like black and white or nothing right or wrong, but there are certain rules which we keep in mind while taking such type of decision. So first of all, there are like certain uh, signpost we follows like autonomy. You know what is autonomy?
Yes, autonomy is like deciding about one's his care, animal in the care. But like say, baby don't have his autonomy, doctor. So then how can we decide about the baby
Yes,
regarding his care?
yes, Dr. Ahmad. So parents They are the one holding parental responsibility, and they are usually uh, the decision taker who has authority to take the decision and for the further care plan. So we together with the parents and the team of the doctors decides for the best interest of the child. So here in case of a baby who is a 25-week-old and having a grade 4 IVH has uh, not a good prognosis. Are you with
Yes,
me?
doctor. Yes, doctor, you're right. But we consult the parents regarding not to continue, then parents will say discontinue.
Yes. Yes, Dr. Ahmad. The reason behind like there is we follow the framework. In the framework, there are conditions like those who have life limited in quantity and those who have a life limited in quality. So,
Mhm.
have you heard about this?
Yes, yes, doctor. Yes, you're right.
So, in case of
But
Ahmad, yes, Dr. Ahmad. So, in case of Ahmad, what is happening is like with the 25-week and grade 4 IVA intraventricular hemorrhage, as well as the Ahmad is on a lot of medical support and breathing machine support. So, quality of the life is limited, as well as the quantity of life also is questionable. Even
yes,
though he becomes a cool, but then he might not have a quality life.
yes, you're right, doctor. Now I am getting your point, doctor.
Yeah, so I appreciate really your keen interest in this topic. Actually, it is a very challenging subject. So, in this situation, do you know how we take this decision?
Yes, we see the viability of the child. We see how the quality of life will be of the child in later, because we need to think about parents also. What kind of child we are giving to them, right?
Yes, you are right. So,
But
uh,
doctor, I want to ask you here, why can't we wait for few more days?
yeah,
Like we have waited for few more days for this baby.
yes, Dr. Ahmad, I can understand your emotions about the babies and regarding the nature of this decision. Uh, but Dr. Ahmad, since baby is already, grade 4 intraventricular hemorrhage, as well as he's on a lot of inotropic support and kind of a multi-organ failure. And during this situation, it is not going to improve any quality of life, and we have to also justify the resources. There is another pillar which signpost us, like it is called justice. Have you heard about this justice?
Yeah, maybe, yeah, justice. Maybe we are giving equal care to everyone.
Yes, the care and the quality and the resources should be provided to those who are in a need and who have a better chance of survival and a better prospect. By saying that, I don't mean that we should not support to the journey, but uh, we have to, think in terms of like the resources where it can be more useful and where it can be uh, meaningful by providing that support to those which babies who are in need of it.
Yes, doctor. 1 minute remaining, 1.5 minute remaining. Yes.
Okay.
Yes, doctor. Yes, you are right. That we have to use our resources judiciously. Now I understood, doctor.
Yeah, so there are other pillars of this framework is like beneficence and non-malefic. So the decision usually is taken on the background of this. It should be in the best interest of the baby, as well as with the involvement of the treating consultant and the multidisciplinary team together with the parents. So I think I have given you a lot of information, Dr. Ahmad. So could you tell me what we have discussed today?
Yes, doctor. We have discussed that in certain key situations, we have to follow the medical ethics for taking the decisions, and there are four pillars of this medical ethics. Also, we have discussed the importance of each pillar and why it is why we have to take such decisions. Doctor, thank you, doctor.
Okay, thank you, Dr. Ahmad. This is a quite challenging subject. I think it would be helpful to all of us and to our department also if you can prepare seminar on this, and we can together go to the library and we can search for the some articles published in the recent journal, and you can make one seminar. And if you have any concern or the questions, don't hesitate to call me back. I would be happy to help you.
Yes, doctor. Thank you, doctor. Thank you for your help.
Thanks, thanks.
Yes. Okay. 9 minutes 30 seconds.
Okay. Sorry, actually, I got a very dry cough, irritative kind of a cough.
क्या हो गया? ज़्यादा हो गया last party में?
Oh, no, no. Actually, I don't like much AC also, but.
Oily खाया क्या बहुत?
हाँ?
Oily खाया बहुत oily?
हाँ, थोड़ा सा oily हो गया, yeah.
So it was very good, Dr. Hiren. The sentences were short, agenda was clear. Just one thing, like when you are talking to medical student, you should not say Dr. Ahmad. You can say plain Ahmad. Even talking to colleagues, we can say by name also. So that is the one thing. And rest of the thing you correctly covered: autonomy, maleficence, justice, beneficence, all everything you explained correctly. Also, that some decisions are not right or wrong. There is nothing black and white in medicine. Such types of sentences, life limited in quantity, life limited in quality. And these things it's important to mention. It was good, like no flaws as such.
I forgot about the baby's name. I don't know whether you told
Yeah,
me.
you suddenly included Jenny. There was no name in the scenario.
After I took water, I just said, okay, I think probably it was Jenny.
You are lingering in previous scenarios. Huh? First scenario, like most, I think. Okay, then we wind up now and we'll decide about next meeting later. Huh?
Yeah. All right. Thank you.
Good discussion today. Thank you.
Thanks. Thanks.
Only 1 minute remaining. Dr. Royal, you want to add something? I think he's busy.
Sorry, boss. Actually, I was completely busy today.
No problem. You can hear this. Dr. Hiran did this scenario nicely. You can hear later.
Yeah, Dr. Hiran, please share and I will listen to. Not today, tomorrow.
Okay.
Okay. Chalo, bye. Good night. Happy weekend.
Good night. Same to you, all of you. Thank you. Bye. Bye.